This video is going to go through a hamstring strength endurance test, which can be useful when assessing patients' hamstring function following ACL surgery. This is usually best done several months into the rehab process once a patient is ready for single leg strength work. Now we're going to take a really simple hamstring curl on a Swiss ball. We're just going to get a patient to do it to failure. What makes it a little bit more sophisticated than a simple hamstring curl on a Swiss ball is ensuring there's consistency. We're always using this test under the same parameters, whether it's the end of a hard gym session or at the beginning of a hard gym session. If we're testing it at different times, we might get different outcomes. Also, we want to make sure there's time under tension. So when we're using the hamstring curl in, that it takes 2 or 3 seconds. And it's the same when we're going with the lengthening phase when we're straightening the leg. And we want to make sure also there's some failure criteria in there. So is the patient touching down with the non-testing leg? Are the patient's hips touching the ground? Is the patient unable to keep the pace of the time under tension? So it's just important to have in your mind what you're going to determine a failure. In a nicer terms, how are you going to end the test? So in reference to interpreting the test, I don't think there is a special number of repetitions that we can safely say if someone gets this, that's a good score. It will be depending on the patient. I think it's just important that we see some sort of progression. Is someone doing more repetitions 6 to 8 weeks after you've tried the test for the first time? Essentially what we're looking for is, can the patient get as close to their non-operated side as possible in terms of repetitions?